Ever walk into a room and completely forget why you're there?
Happens to the best of us.
Totally. It's like
Mm.
a universal brain blip, right?
Right.
But imagine that feeling, that momentary confusion, if it just kind of stuck around,
Yeah,
became your reality. That's what millions living with dementia face every day.
it is. And it's a reality more and more of us are going to face, unfortunately, whether ourselves personally or through, someone that we love.
Exactly. And that's why we're doing this deep dive, right?
Absolutely.
And this is a free online course from Allison. It's called Caregiving Skills Dementia Care.
It's a good one.
So let's just dive right in. Dementia. What does it actually mean? I feel like it's one of those words that gets tossed around, but like beyond memory problems, what are we really talking about here?
You're right. It does get used maybe a little loosely sometimes, and people hear it, and they don't really know exactly what it means. It's not a single disease, dementia.
Oh, interesting.
It's more like an umbrella term
Okay.
that covers a whole bunch of conditions. It's kind of like, if your computer starts glitching out,
Yeah.
there's a million things that could be wrong, right?
Totally.
It's not just one thing. It's a whole category of things. And memory loss is a big part of dementia, but it's not the whole picture.
Because I was reading through the course, and it really struck me how dementia impacts so much more than just memory. It's like thinking, behavior,
Yeah.
reasoning.
Absolutely.
A lot to unpack.
Yeah. And that's where the care in dementia care really comes in.
For sure. And, maybe this is a good place to clear up something I was confused about for a long time.
Mm-hmm.
What's the difference between dementia and Alzheimer's?
Yeah. Interchangeably, but they're not quite the same.
Because I did for years.
Yeah, and you know what? It's understandable because Alzheimer's is the most common type of dementia.
Oh, okay.
So it's kind of like if you were thinking about that computer analogy, Alzheimer's would be like if a specific program kept crashing.
Okay. So there's that. And then what else? What other types are we talking about?
Well, there are a bunch, but two that this course really digs into are frontotemporal dementia and Lewy body dementia.
Okay. So frontotemporal, what's that one all about?
So that one is often caused by reduced blood flow to the front part of the brain. And that can impact personality and behavior even more than memory, at least in the early stages.
So someone with that kind of dementia might seem like a totally different person before their memory really starts to go.
Yeah, that's a really good way of putting it.
Wow. Okay. And then what about Lewy body?
So Lewy body dementia, that one's caused by these abnormal protein deposits in the brain. They're called Lewy bodies.
Okay.
And basically, they disrupt the way the brain normally communicates with itself. And what can happen with that is you get, in addition to the memory problems, hallucinations and these fluctuations in alertness.
Whoa. Okay. So it's not just that dementia looks different in everyone. It's that each type has its own whole set of curveballs. Makes you realize how important a proper diagnosis really is.
Yeah. Oh, it's essential. It's like, you don't want to be trying to fix your computer with the wrong troubleshooting guide.
It's like you need a whole different playbook depending on what type of dementia we're even talking about.
Exactly. And that's where this whole idea of caregiving skills comes in.
Right, because it's got to be about so much more than just being patient. Right?
Oh, absolutely. Patience is key. Don't get me wrong.
Of course. Of course.
So this course, it really opened my eyes to this idea of validation therapy.
Validation therapy. Wait,
So instead of trying to correct someone with dementia or argue with their reality,
yeah.
you basically meet them where they are.
So if my mom was saying, oh, I went to the store today, but she didn't, I wouldn't be like, no, Mom, you didn't.
Exactly. You'd say something like, oh, tell me about your trip to the store.
Wow.
Because by validating their feelings, you can actually prevent a lot of agitation and just create a much calmer environment.
That makes a lot of sense.
Yeah,
It's almost like you're learning a whole new language to communicate,
they
right?
got it. It's about understanding that their brain is working differently now.
Right.
And that takes a lot of compassion and flexibility on the part of the caregiver, for sure.
And let's be real. It's not like caring for someone with dementia is a quick thing. This is like a marathon, not a sprint.
Oh, 100%. And this course, it doesn't sugarcoat that at
I
all.
appreciate it because they have a whole section on caregiver burnout.
Yeah, and self-care, which is so important.
So important because you can't pull from an empty cup, right? If you're burnt out, you can't possibly give the best care.
Exactly. And that's why this course really emphasizes building a support system.
So it's not just about taking care of the person with dementia.
No.
It's about the caregivers taking care of themselves, too.
Exactly. Having people to lean on, resources to tap into.
That's huge.
Right. So we're talking support groups, respite care, anything that allows the caregiver to recharge those batteries.
Because you deserve that.
Absolutely. You
Yeah.
can't be giving your all if you're running on fumes.
Exactly. Exactly.
It's all about balance. And
Yeah.
speaking of balance, another thing the course talks about, engaging with dementia patients in ways that actually stimulate their brains and emotions.
Oh, yeah. Yeah. That was a really interesting part. Because it's not just about keeping them busy, right?
Yeah.
It's about finding activities that really connect with them on a deeper level.
Yeah.
What would be an example of something like that? Like, what kind of activities can actually, I don't know, reach someone whose cognitive abilities are declining? What kind of activities can actually reach someone whose cognitive abilities are declining?
Well, think about what you find comforting
Yeah.
if you're feeling kind of out of sorts.
Def-
Music. Music is huge.
Oh, yeah.
And this course talks about how powerful it can be to use music from someone's younger years.
Interesting.
Because those familiar melodies, they can sometimes spark memories
Right.
and emotions even when other memories are fading.
It's true. It's like you hear a certain song and you're instantly transported back to, like, high school or something.
Exactly.
Ah.
Exactly.
It's amazing how music can just bypass all that.
It's powerful.
What else besides music?
Even something as simple as going through old photo albums together.
Oh, yeah.
That can be really powerful, or engaging in activities that someone used to love. Like if they were a big gardener,
Yeah.
even just being around plants, helping with some potting.
Right.
It's about meeting them where they are.
I love that. It's so true. This whole deep dive has really given me a new perspective on dementia care.
Yeah.
It's not just about managing symptoms. It's about preserving someone's dignity
Yes.
and quality of life for as long as possible.
Absolutely. And that I think is one of the most important takeaways from this course. There's no one-size-fits-all approach.
Right.
Every single person living with dementia is an individual
Of course.
with their own history, their own preferences, their own needs.
Totally. Makes you realize that caregiving, it's not just a job. It's like an art form in a way.
Beautifully said.
Because you really have to understand the person you're caring for.
You do. And like any art form, it takes, knowledge, it takes skill, and it takes, above all, empathy.
Empathy, yeah.
And this course from Allison, I think it's a really great starting point.
It is. And the fact that it's free, it's accessible to anyone, I mean, that's incredible. That aligns perfectly with what we're trying to do here at the Deep Dive.
For sure.
Make insightful information readily available.
Yep.
So, as we're kind of coming to the end of this deep dive, I think if there's one thing for our listeners to take away, it's that knowledge is power.
100%.
The more we understand dementia, the better equipped we are to support those living with it and the people who care for them. So if today's deep dive has sparked your curiosity, head over to Allison. Check out the full course, Caregiving Skills, Dementia Care.
Yeah.
Like we said, it's free, it's insightful, and it might just change the way you think about dementia care.
It might.
Totally. Well, thanks for joining us for this deep dive into the world of dementia care. Until next time, stay curious.